consultant from Gupta Multispeciality Hospital, Sant Avenue, Amritsar. I've been asked to express my views about the cervical cancer screening. We celebrate January as the Cervical Screening Awareness Month. Actually, it is very important for us to screen because, as we all know, cervical cancer is the only cancer which has 15 years of precancerous conditions which can be detected, and early diagnosis can only lead to early treatment. Early treatment is important because we can control the spread of the disease at every level and every stage. It is very common in India to have women having cervical cancer, women having chronic white discharge, women having foul smelling discharge, and it is therefore important to go for the screening every time we think that there is something wrong, there is something not very normal about our vaginal health. For this we can have, there are two types of screening actually. In one we do the pap smear alone, and the other one in which we do the HPV DNA detection. It is the virus which is present over the cervix, cervical cells, which can cause cervical cancer in later years. So if we go alone for the pap smear, then it can detect at that stage how much changes have already been occurred in the cervical cells. HPV DNA, if we go for, it will tell whether or not we can have the changes in future. So it will lead to a more early detection of cervical cancer. It's better to go for both the tests together, that is the liquid based cytology along with HPV DNA. So in India, it is very common to have cervical cancer. We should not ignore the vaginal health of the and Indians are very shy to tell about their problems. They come to the doctor only when it is already out of our hands or out of our reach. So it's better to go for the screening test, and you should not shy away with the cervical screenings or no, I'm not having any problems. As routinely also, all the women who are sexually active should undergo this cervical screening whether or not they're having any symptoms. For the prevention, we have the vaccines also to prevent the teenage girls. So it is very important, and if there are facilities available, why not go for it? Why not take the chances, opportunities, and live a healthy and peaceful life thereafter? Thank you.